John Popovich here again in front of the living wall for another of the Legends interviews, and it's a distinct pleasure that I have in interviewing Ronnie Hall. Ronnie is the Chief Nursing Officer of the Henry Ford Health System and the Chief Operating Officer of Henry Ford Hospital. Ronnie and I actually have a career path that has gone together for the last 30 years. And it's really a pleasure to have you here on Doc and the D.
Thanks, John.
Ronnie, tell me how you got into nursing.
Well, actually, it was kind of by an accident. I was going to be a clinical engineer, and I actually had an athletic and academic scholarship, and one of the people who lived in the house was a nurse, and she came by and said all the great things in her patients, and I soon did an internship at Dow Chemical and said, well, that's not for me. Nursing's for me. Changed that instantaneously after that.
So what was the first job that you had at Henry Ford?
My first job was a graduate nurse down on I-1, which was a Metro Medical floor. Got hired in, and from there I moved to F2 with the floor. It became internal medicine and eventually became pulmonary. And then I became the nurse manager on B2 as a geriatric medicine floor. In between there I was a nursing supervisor, ran midnight shift, which was always a lot of fun here. And then after that, actually, you and I had met when I was over on F2, and you wanted to open up an intermediate unit. You came to me and said, I got a great job for you. This is going to be a great intermediate unit. And I said, well, it's a higher level of care. And you said, you'll learn. And we opened up a 12-bed intermediate unit.
What do you find to be the most challenging part of your job?
Sometimes I think some of the most challenging part is you can see where you think we need to make changes, and it feels like we can't be quick enough to make changes across the system perspective. I think that's some of my most challenges. But, I come to work every day. I'm excited about what we do. I'm excited about the people we work with. I think it's an incredible place. You know what? The best decision was in 1984 when there was a glut of nurses to be hired into a place like Henry Ford Hospital.
What we're going to do is we'll take a little trip down memory lane. We'll go to where you and I started our careers together, and I think it certainly was one of the great opportunities that you had, perhaps, but even a greater opportunity for me as my career progressed. So let's take a trip up to the old MICU.
Great, looking forward to it.
Great. Well, Ronnie, here is where our paths started crossing in a meaningful fashion. Tell me about this unit.
Well, back in 1989, this was a 12-bed step-down unit because we only had an 8-bed MICU back then. So we said this was going to be a great job for a step-down, and it really turned into a really big 12-bed ICU rather quickly.
Collaboration is an interesting way of approaching care, but probably there's no other way you could take care of patients with this type of illness.
No, it was a great rounding when you have a senior staff, you have a fellow rounding, you have the nurse there at the bedside who's able to collaborate and hear what's going on with the patients, the family dynamics, and again, it's not only just taking care of our patients, it's really taking care of some of the most critical patients with the most family dynamics that you'd ever want to hear from. I mean, honestly. So it became this, we are all here for the one purpose, and that was the patient. Make sure things had a positive outcome.
What is it that you learned as you were head nurse in the early stages of the intermediate unit and then subsequently the ICU that you continue to use to this day?
I have to tell you, John, it's really being open, being honest, being upfront. Make sure that you're hearing what people, listen to what they're saying to you, and make sure that as people approach you with issues, that you always circle back, even if you can't resolve them, tell them what you've done, complete that, and establish relationships. Our organization, this hospital, really runs on the relationship-based care. When I talked about that teaming, everybody knows who's what role, what job, and what our purpose is, and I think that's the most important thing.
So Ronnie, we're in another part of the hospital now. Can you describe where we are and kind of your role in developing this area?
Well, actually, we're kind of, this is a spot where we have all of our families come when they're having here for an OR surgery. So it's kind of our OR waiting space. It used to be kind of more like, I guess you would call it like bus stop. So we actually had to spend a lot of different kinds of architect to come in, take it right down to the studs, all the way up to the ceilings. And we kind of, if you, on the other side, we've created space for families to wait that's unique for them on their furniture. We've created a nice kind of area for them to eat while they're waiting for these long, complex surgeries to kind of come out. And it's probably one of the best things we've done. You know, people feel like it's more modern from what we were.
You know, there's a lot for you to be proud of during your tenure here as Chief Operating Officer, and this being one of them. Certainly the atrium where we filmed in front of the living wall, at least in terms of facility aspects. The placing of Papa Joe's to expand our food services and such. But what is it that when you look back on the last, say, 5 to 8 years, what do you consider to be some of the highlights of what you've done?
You know, I never kind of think about it as just what I've done, but it's always the team that helps us get things done. Like you said, the Papa Joe's expansion, when we did the remodel in the cafeteria, as much as that was kind of, now it's old, it really was a big significant uplift for our employees and our staff to be able to go eat. I think, you know, some of our others is really planning for our bed capacity, our growth in the last, and I have to contribute both of that to you, going out, traveling around the state, bringing those greater than 50-mile patients here. So I'd say that in the last 5 to 8 years, it's getting the case mix up, honestly, John, and it's our growth, because we continue to invest in our employees and our plant here.
It's a great shot here. We have a replica of the Diego Rivera mural from the Detroit Institute of Art, one of the great pieces of art of the 20th century, one of our important family members, Edsel Ford, had a major hand in really commissioning Rivera, and his wife at that time, Frida Kahlo, to be a part of the heritage of Detroit. Well, we made it up to the P6 unit, one of the more recent additions that we've had at Henry Ford Hospital in the pavilion, the Henry Ford II Pavilion. Ronnie, tell us a little bit about the rooms, how they were constructed, and really the basis for the layouts of the room.
Well, actually, you know, these rooms were kind of constructed off when we were doing West Bloomfield build. We actually had a warehouse. We had staff come in and put input on it. You can see that we have curved walls, just like that of West Bloomfield. Actually, the 5th and 6th floor were built before West Bloomfield opened. It's pretty much designed. You can see the molding. It's just different kinds of colors. We actually have insulation in between the walls that go all the way up the ceiling. Insulation on the top, so you don't hear anything. That was one of our big complaints for our patients, where they were in semis, but we were very noisy. So they have their own rooms that can control the air temp a little bit by about 2 to 3 degrees. So big hit for us.
Yeah, it's a remarkable difference when you have a room of this nature. First of all, they're all private rooms.
All private.
Which is a benefit for a lot of reasons,
yeah,
both in terms of the patient comfort, infection control reasons, and the like.
You're absolutely right. The sink, so if you look at the way the room is designed, you have a patient, the nurse, and clinical people can come in here to wash their hands in the sink, and so you have a way the room works and functions. So that was one of the key designs, and we had input from the staff, even as far as how the head walls were even set up and the electrical was set up. So it's worked out. Like I said, this unit scores very high on the express gaining and service scores, but the environment works out very well.
Yeah, environment isn't the only thing in terms of having
not.
Patient satisfaction, but it sure is an important variable in terms of quietness, cleanliness,
yes,
the ability to meet family expectations and the like. And you're right, it's an incredible design. So we've been fortunate to hear about Ronnie Hall's incredible career and her story, and had an opportunity to go back to the old medical intensive care unit, where she really not only what I think cut her teeth in very complex intensive care, but it's a point in which we actually had an opportunity to work together. And we've had a great opportunity to work together for the last 8 years as well. And we look forward to continuing to see Ronnie contribute so greatly to the Henry Ford Health System and to Henry Ford Hospital in particular. So thank you for joining Doc and the D, Ronnie.
Thank you, John, so much.
You're welcome.
My pleasure.